All right, Ninja Nerds, in this video we're going to talk about the anatomy of the heart as well as the layers of the heart. So first off, a little bit about the anatomy of the heart. Where would you actually find it? Well, you'd find it within the thoracic cavity, but you'd find it within a special cavity in the thoracic cavity called the mediastinum. So it's actually found within what's called the mediastinum. There's actually different components of the mediastinum, like the superior mediastinum, the central, anterior, and posterior mediastinum. We're not going to get into all that. Another thing about the heart is not only is it situated within the mediastinum, but it's actually shifted about 2/3 to the left of the mid-sternal line, okay? So it's kind of shifted to the 2/3 to the left of the mid-sternal line. That's another important thing. So when you look at it, the apex of the heart is actually pointing towards your left hip, and the base is actually pointing towards your right shoulder. Another thing about the heart is that it's actually going to weigh approximately about 200 to 300 grams. They generally say it's about the size of a fist, okay? So that's kind of the just basic concepts about the heart. And again, apex is pointing towards the left hip, and then the actual base is pointing towards the right shoulder. Now, when we look at the heart, we actually see a bunch of different chambers within inside of the heart. For example, if you look here, you see these two top chambers here? These two top chambers are called your atria, right? So plural form is the atria. But for example, since this is going to be on the right side of the heart, this is on the left side of the heart, this is referred to as the right atrium. And this one over here is referred to as the left atrium. The big difference between these is what is actually going to be filling them also. So for example, if you look at the right atrium, it has 3 big vessels that are emptying blood into this cavity. One is this bad boy right here. This structure right here is actually called the inferior vena cava. It's a big vein that's bringing blood from beneath the diaphragm, from the lower appendages, right? As well as some of the abdominal viscera and a lot of different other structures. So this structure is called the IVC, which is called the inferior vena cava. Then you have the one that's above the diaphragm, bringing blood from the head, the neck, and even the upper limbs. So this is going to be called the superior vena cava. So we have the inferior vena cava, superior vena cava, and we have another vessel that's emptying blood in here. What is this structure here called? This structure is actually emptying blood into the right atrium too. And this is called the coronary sinus. So it's the opening of the coronary sinus, which is one of the structures that is basically taking blood from the myocardium of the heart and returning it back to the right atrium. You also have a little bit of scar tissue in this area. You know, whenever you're born, generally, there's a hole between the right atrium and the left atrium called the foramen ovale. But whenever the actual fetus starts growing up and stuff like that, the actual hole basically closes up and becomes a lot of scar tissue. So imagine here, I kind of draw like a little bit of scar tissue here. And this scar tissue right here is representing what's called the fossa ovalis, which used to be the foramen ovale in the fetus, okay? So they call this one here the fossa ovalis, okay? So that's that. Another kind of important thing about this is that there's some specialized nodal cells. We talked about this in other videos, so we're not going to spend a lot of time here, but there's another like nodal cell, a bunch of different types of nodal cells, which are autorhythmic cells. They can generate action potentials and set your sinus rhythm. It's called your SA node. And we even talked about it more. We had one right here, which would be the AV node. Then we'll go into the bundle of His, the right and left bundle branches, and the Purkinje system. We're not going to talk about all of that right now. Okay, we do that in another video on the intrinsic cardiac conduction system. All right, so that covers that part. Now there's the next thing, the left atrium. What's emptying blood into the left atrium? The left atrium is receiving blood from a couple different structures here. It's all the same, but they're basically bringing blood, these structures here and over here. It looks like it's emptying blood into this side of the heart, but it's not. It's coming around from behind the heart. And it's dumping in over here. So imagine it's dumping in over here from these two little red veins over there. These guys are emptying blood into the heart. And what's really important about this is that these veins are emptying blood that are coming from the lungs, from the pulmonary circulation. So because of that, these are called pulmonary veins. So these guys are here called your pulmonary veins. And they're really important because they're bringing oxygenated blood from, for example, we said that this is the left side of the heart. This is the left pulmonary veins, bringing blood from the left lung. Whereas over here, what do you think these are called? These are the right pulmonary veins. And the right pulmonary veins are bringing blood from the right lungs. But remember, both the right and the left pulmonary veins are emptying blood into the left atrium, okay? Now, what else is really important about this? We covered that. Well, now we got to talk about what is this partition here in between the atria and the ventricles. These are called valves, and they basically are providing a one-way flow. We don't want things to come back, right? So what happens is, what is this valve right here called? This valve right here is a special valve. This is called the tricuspid valve. So you can call it the tricuspid valve, or another name for it is you can call it the right atrioventricular valve, because it's separating the atria from the ventricles. So that's why you can call it atrioventricular valve, and it's on the right side. This one over here, which is separating the left atrium from the left ventricle, is called the bicuspid valve. The bicuspid valve. Or another name is the mitral valve, or the left atrioventricular valve, because it's separating the atria and the ventricle on the left side. Now, a little bit of thing about this valve here is if you look at it, it's actually kind of cool because it's layered really, really nicely. When you look at the inner part of it, it's actually consisting of different layers. So it actually has a couple layers in here. And it has a lot of collagen and elastic tissue on both sides. And it also has a little bit of other different types of spongy tissue in here. It's actually made up of two different layers called the zona spongiosa, the zona fibrosa, and even another one called the zona petricularis. And there's endothelial lining around it. So just so that you know, the valve is actually made up of 3 different individual layers. And again, those layers are the zona fibrosa, zona spongiosa, and the zona ventricularis. And then surrounding it is going to be a nice little epithelial tissue called the endothelial lining. All right? All right. And that covers that part there. Now that we have these valves separating these structures, what's another important thing about these valves? These valves are actually connected through these nice little collagen cords. Let's actually make these collagen cords here. There's these nice little collagen cords here. Let me get the tricuspid valve out of the way here. There's these nice little collagen cords that are attaching to the cusps of the valves. And they're nice little collagen cords, and they're anchoring the valves in a nice taut position, tight position normally. Okay, so these little collagen-like cords here are super, super important. What are these collagen cords here called? These collagen cords are called chordae tendineae. So what are these cords here called? They're called chordae tendineae. And the tendineae, the chordae tendineae, are collagen cords, and what is their purpose? They're basically collagen cords that are attaching to the valves and keeping the valve flaps really nice and tight to prevent them from backflowing up or actually ballooning back into the right atrium. So this is important. Another thing is, these chordae tendineae, how do we anchor them down? How do we keep them nice and tight? There's the muscle that actually kind of protrudes out from this area here and attaches to these chordae tendineae. So there's actually these nice little peg-like muscles that are pumping out here and attaching to these chordae tendineae. And these muscles are super, super important because they're the ones that are anchoring these actual chordae tendineae down, which are anchoring these valves down. What are these muscles here called? These muscles are called your papillary muscles. Okay, they're called your papillary muscles. Really, really important. The reason why is that when people get what's called MIs or heart attacks, basically what happens is ischemia occurs to these muscles. And when they become ischemic and maybe even start actually being affected severely because of that, they can become weak and not able to contract. If they can't contract, they can't hold on to those chordae tendineae nice and tightly. So what starts happening to the valve flaps? They start becoming loose. And whenever the right ventricle contracts, it can push the valves back up. Okay? And that can cause what's called a valve regurgitation. And that's not good. That's really bad. Okay? But it's more common over here on the actual left side of the heart where the bicuspid or the mitral valve is. And just so that we're aware, this valve here, I'm going to just abbreviate it, is the tricuspid valve. All right, sweet deal. That covers that. Now, let's get into this part. What is this chamber here called? What is this chamber of the heart here called? This chamber of the heart is actually referred to, since it's on the right side and it's the pumping chamber, this is called the right ventricle. This is called the right ventricle. Very, very important one, okay? Now, same thing. Over here on the left side, you would still have those collagen cords. Let's say that I do the same thing here and I abbreviate my bicuspid valve here. For just a brief moment here, I put BV or MV because it can be bicuspid valve or it can be mitral valve, or you can even call it left atrioventricular valve. And just again, what's that little recap here? What are these little structures here called? They're called your chordae tendineae. And the chordae tendineae are nice little collagen cords, and they're anchoring the actual valves to these muscles here, which are called the papillary muscles. All right. Now the next thing is, what is this chamber here called, where the blood is actually coming down from the left atrium into this chamber right here? This chamber here is called the left ventricle. This is the left ventricle. Very, very important pump. This is a very, very powerful pump. Now, we get into the next thing. The right ventricle will have to pump blood into this big old pulmonary circuit here. So when it tries to pump blood into this pulmonary circuit, it has to go through another set of valves. What are these valves here called? This valve right here is separating the right ventricle from the pulmonary trunk. This is actually called your pulmonary trunk here. So we call this, and it actually looks like half of a moon. So it's like semilunar, right? So they call it semilunar, but it's going from the right ventricle to the pulmonary trunk. So it's called the pulmonary, I'm going to abbreviate it, semilunar valve. Okay? So this is called the pulmonary semilunar valve. Now, there's another one that's actually separating the left ventricle from the aorta, and it looks like half of a moon. So what do you think that one's called? It's called the aortic semilunar valve. These are also very, very important too. Okay, so we have the pulmonary semilunar valve separating the right ventricle from the pulmonary trunk, aortic semilunar valve separating the left ventricle from the aorta. These are important. What is the purpose of valves? It's to prevent the backflow of blood, to provide a one-way blood flow. Alrighty, and that covers that. Now what I need to do is I need to start going through the actual parts of the heart, like a little bit more like thick structures wise. So if you come right here, you see how what separates the left ventricle from the right ventricle? What is that big old septum there called? Well, it's separating the ventricles, and it's in between them, so it's called the interventricular septum. So we call this bad boy right here, if I were to kind of write it in between here, they call this the interventricular septum. So it's called the interventricular septum. So the interventricular septum is separating the right ventricle from the left ventricle. It's really, really important that we have that barrier, because if not, the blood could be moved back and forth, mixing the blood. This is actually a common congenital disorder, which occurs in the tetralogy of Fallot, where they actually can have what's called a ventricular septal defect. Terrible, terrible situation there. Okay, now you can't see it. It's hard to see because we have the pulmonary trunk and the aorta blocking it. But there's another septum in between the left atrium and the right atrium. It's called the interatrial septum. Okay, just so that we're aware of that. All right, so now, before we start going over the layers, I want to hit just some of these great vessels that are coming off here real quickly. So what is this guy right here? Well, we said that there's the pulmonary semilunar valve separating the right ventricle from the pulmonary trunk. So this whole big old beast right here is called the pulmonary trunk. Now, the pulmonary trunk comes up and splits into two nice, good old arteries that are going to go to the lungs. So this one here is going to be going onto the left side of the, so they're going to the left lung, so they call this the left pulmonary artery. This one over here is going to the right lung. So since this one's going to the right lung, this would actually be considered to be the right pulmonary artery. The next thing, the aortic semilunar valve is separating the actual left ventricle from the aorta. So when the blood is going up here, it's going through the ascending aorta. So this right here is called the ascending aorta. And then we go up into this nice little arch called the aortic arch. Now this is an important thing, because if I were to label this right here the aortic arch, there's actually three important vessels that come right off of the aortic arch. And we're going to go with them in order. So the first one is called the brachiocephalic. So this first one right here is called the brachiocephalic. That's the first one right here, okay? The next one is going to be called another special one, and this is called the left common carotid artery. So we're going to denote that LCCA, left common carotid artery, okay? And the last one is going to be what's called the left subclavian artery, okay? And just so that you're aware, if you really are curious, because I know that you guys are, the brachiocephalic is actually going to split into the right common carotid artery. So this splits into the right common carotid artery, and it also is going to split into another one called the right subclavian artery. Just so that you're wondering, well, where the heck is the right one for these two guys? Okay, that's where it's coming from. And then again, what will happen is eventually the blood from this aorta will continue and go spread out to the multiple parts of the systemic circulation. Now, let's cover the layers of the heart, from inside all the way to out. All right, so we imagine here that blood's going to be in these chambers, but what's lining the different parts of the heart? So if you see this kind of like inner layer, that maroonish layer right here, this layer here is made up of an endothelial tissue. Okay, so it's made up of like an epithelial tissue with a little bit of areolar connective tissue underneath it. This one right here is lining the inner layers of the heart, so we call it the endocardium. So we call this layer, the innermost layer, the endocardium, okay? Then we go from the endocardium, we go a little bit more out, okay? We go a little bit more out here and we get into this middle muscular layer right there. This middle muscular layer right here is made up of nice cardiac muscle tissue. So very, very good cardiac muscle tissue. And this cardiac muscle tissue, that's the middle layer here, this one is called the myocardium. So it's called the myocardium. And again, what type of tissue is it made up of? The tissue it's made up of is going to be cardiac tissue. So this is made up of cardiac tissue, so muscle, cardiac muscle tissue. All right, very, very important one. Now, another little just kind of reference point here is when you're looking at the heart, the left myocardium of the left ventricle as compared to the right myocardium of the right ventricle, the left ventricular myocardium is much thicker because it has to pump blood. For example, the right ventricle only has to pump blood just to your lungs and back, whereas the left ventricle has to pump blood all the way down to your little toe and then back up, right? So you can imagine why this one has to have a thicker myocardium because it has to be a very powerful pump. Then we go into this outer blue layer, this nice little teal layer here. This teal layer right here is actually called, has two names. You can call it, give it two names. We can call it the epicardium, or we can give it another name. And I'll explain why we give it this other name in just a second. Another name that you can give it is called the visceral layer of the serous pericardium. You guys are probably like, I think I'm going to stick with epicardium. I wouldn't blame you. Just giving you guys options of what the other names are. The next thing here is we have a lot of fluid here in this little cavity here. There's a lot of what's called this pericardial fluid, which is this nice serous fluid here. Usually there's no blood or anything like that in this area here, right? Under normal physiological conditions. It should just be a nice like serous fluid. This area right here is important because this is called the pericardial cavity. This is called the pericardial cavity. So it's just made up of a nice serous fluid. Now generally, why is this important? Because in certain situations, when there's actually going to be less fluid, there can be more friction between this blue layer and this green layer. And that's really bad because that can cause what's called pericarditis, which is a very, very severe pain that these people develop because of the friction that's rubbing up against between these two layers. It's like a stabbing pain, they say. Okay? So it's, again, this is really important that allows for these two layers to glide up against one another during contraction and relaxation and prevent friction. So a very important function of that pericardial fluid. Last one here, this green layer is actually going to be what's called, this is why that other name is really important here. They call this the parietal layer of the serous pericardium. So this is the continuous layer. So for example, I want to show you right up here. You see how we have this blue layer here? That's that epicardium or the visceral layer of the serous pericardium. Look how it transitions. You see how they're continuous with one another? So it goes from here all the way to this one. That's how it should be. So normally you have a visceral layer covering the organ and a parietal layer covering the actual wall of that cavity. Okay, in this case it's this pericardial cavity. Okay, so that's the parietal layer of the serous pericardium. Now on the outer parts of it, we have this brown layer, and this brown layer is so important. This brown layer here is called the fibrous pericardium. So it's called the fibrous pericardium. Super, super important structure. It's actually made up of what's called a dense fibrous irregular connective tissue. So it's made up of dense, irregular connective tissue. Super important. There's actually three functions of the fibrous pericardium. Three important functions here. One of the functions is it basically helps to anchor the heart. So it helps to anchor the heart to the surrounding structures. That's one function, to anchor the heart to the surrounding structures. The other one is to protect the heart. Because it's a nice, thick connective tissue, it's going to provide a lot of protection to the heart for any type of trauma or any type of damage or any type of other types of things that could actually cause the actual inner parts of the heart to be affected. So it's good at protecting the heart because it's a nice, thick connective tissue. And because of this fibrous pericardium, the blood can't overfill with the actual blood. The heart can't overfill with blood. Because whenever the heart is actually accumulating blood, it can stretch. Well, this fibrous pericardium is not distensible. It doesn't want to stretch. So it prevents the heart from overfilling with blood and overstretching. That's an important function. So it prevents heart from overfilling with blood, right? So that's another function. So this is the function of the fibrous pericardium. Okay, 3 very, very important functions. Anchors the heart to the surrounding structures, protects the heart, and prevents the heart from overfilling with blood. So that covers that one. Now, in this, we've actually talked about all the different layers. And I just want you to understand one other thing, that just because I did it for these ventricles, it's the same for all the other chambers of the heart. Now, another thing here is that if you look here for the mitral valve or the bicuspid or the aortic semilunar valve, they're also covered with that nice endocardial lining, okay? So Ninja Nerds, we have pretty much covered everything that we're going to need to know here for basically the anatomy and the histology of the cardiovascular system. I really hope it made sense. I really hope that you guys did like it. If you guys did, please hit the like button, comment down in the comment section, and please subscribe. As always, Ninja Nerds, until next time.